A lot of my patients say they've never really been to a doctor that practices the way I do, spending so much time with them and explaining in great detail their conditions. I like dealing with hair loss because I can help people, and I think it's mainly because I can help people. I've been recognized as a national expert on the diagnosis of alopecia under the microscope. I think that I'm an expert in skin pathology, and I have a really good knack for correlating what's on the slide, what's under the microscope, with the patient. I pretty much teach them everything I know about their condition because I think it really helps the patients. There's tons of misconceptions about hair loss, the cause, the treatment. Most patients come in with a preconceived notion as to what they have and what they might want to do about it, and a lot of times it's incorrect. The most common misconception that patients come in with is that their hair loss is being caused by stress. And what I tell patients is stress almost never causes hair loss, but hair loss almost always causes stress. When a patient comes to me, he or she should expect to spend 1 hour, during which time we will talk about the history of their hair loss. They will have already received a packet with a questionnaire regarding their history of hair loss and other medications they may be taking. We'll go over that for maybe 15 minutes, talk about how it all started, what they perceive has changed about their hair, and followed by me reviewing any laboratories they may have brought, any slides they bring with them, followed by me looking at their scalp and doing certain measurements or inspections, maybe taking photographs, and hopefully culminating in me making a diagnosis of the type of hair loss they have. Once that's done, I teach them everything I know about that kind of hair loss. I don't take insurance for my hair loss patients, but I do fill out the insurance form and either submit it on behalf of the patient or help the patient understand how to submit the form so that they can be reimbursed. Some insurances allow patients to go out of network to see a specialist, and some don't. So I help the patient to call the insurance company, find out whether or not they can go out of network, and if they can, how do they go about getting reimbursed, or at least some partial reimbursement. Patients are relieved. I'd say relief is the biggest. Relieved that they have found someone who understands what they're going through and can actually know something about it, know something about the diseases. More than half of women hug me when they leave, way more than half. So, I mean, they're happy. They're happy. They're happiest if I can give them therapy that will work. But even if they have a condition that's not that treatable, I think they're happy to have found someone who knows something about what they have and who understands hair loss and the emotional aspect of hair loss.